Why would I need a root canal?
The reason why most people need a root canal is because the nerve within the tooth has died or perished, whatever you want to call it, or the tooth may be in the process of dying and leading to dental pain. And in that situation, if the tooth is still relatively intact, we can basically save the tooth by removing the nerve tissue from within the tooth, thus relieving you of pain. And that's why you need a root canal.
Is a root canal painful?
Yes and no. Root canals generally get a bad reputation for hurting. And generally speaking, the reason why a root canal hurts is because the tooth is really inflamed and the nerve is still partially alive. And the pain is actually coming us from us triggering and stimulating the nerve as we're removing the nerve tissue. That's why you may get a few brief moments of pain when we're removing the nerve tissue, and that's it. That should be it. There should be no more pain after that. But if the tooth is dead, then it should be a relatively comfortable experience once you're anesthetized.
How long does a root canal procedure take?
Depending on the complexity and the number of canals in a tooth can have anywhere between one canal to four canals or above. So if there's less canals, less time, we'd like to book about 2 hours in general.
Is a root canal considered major surgery?
The answer is it is a major procedure, but it's not considered a surgical procedure in the field of dentistry. There are surgical options for treating the roots, but root canal is not considered surgical.
Can I get a crown after a root canal?
That's an excellent question. Generally speaking, if it's a back tooth molar, we generally do recommend that you get a crown on the teeth just to help protect the tooth because those are generally your crushing tooth. After root canal, the tooth is a little bit more brittle, and we do generally want to protect those molars because you've done a significant investment in doing the root canal, so we want to keep that tooth for as long as possible. If it's in the front and the tooth is relatively intact, there may or may not be a need for a dental crown to help protect the teeth.
Are there better alternatives to a root canal?
In this day and age, we generally try to save natural teeth if possible. Your natural teeth are still a much better option if we can save them than compared to the other replacement options that we can offer you, such as either a denture or a bridge or a dental implant.